Hi. Today I want to talk about OCD and addiction and how so many people with OCD develop addiction problems because of their need to self-medicate to deal with the disorder. It's like a whole other monster, addiction in addition to the OCD monster. And, before I begin, because I do want to talk about my story a little bit and what I'm doing to deal with everything, but basically, the thing is, there's a stigma with OCD and a stigma with drug use, and it makes it difficult to talk about it. But the reason why I'm doing it, and I'm going to tell you a little bit about my past, is that I think it's important because, when we suffer alone is when we truly suffer. So if you are dealing with this stuff, there's ways to get help, and, things will get better. And, there's good stuff and bad stuff about self-medicating, so I'm going to get into that briefly. So basically for me, I started out when I was a teenager with depriving myself of food. So basically, I got a stomach ache, and it was a way for me to control my diet, control my feelings, distract myself from my thoughts, and then after that, I was getting hungry a lot, and I was getting really emotional from all the hunger. So after a few years of dealing with that, I moved on to smoking weed, and smoking weed I thought would help me get the munchies, which it did. And then it would help me sleep, which it also did. And it was nice to get just like a break, and I really appreciated that. And then after that, I started on with Ativan, which is an anxiety pill. And you're only supposed to do that for like a short amount of time, but I got pills a lot and pretty easy because I was sick a lot. That was the other problem. I was so stressed because I was sick with systemic infections all the time, so I was in the hospital a lot. And it's a drug that you're supposed to only use it for like 2 months. It's got a high dependency risk. I did get dependent on the drug, and the side effects were really shitty. So I had sexual dysfunction and stumbling everywhere, just like walking into stuff, and I developed hallucinations. And I started withdrawal one day when I forgot to take my dose, so I kind of knew I had a problem. So I got off of it over the course of, a few weeks, just so I could do it safely, and I did all my research on that, which I would encourage everyone to do, is make sure you get off drugs safely if you want to do that. And then I tried mushrooms, which I heard helped with OCD symptoms, which they do. But the first time I did it was like kind of an impact, like, whoa, that was really cool. And then after like the next few times I did it, it wasn't quite as like, whoa. So, the effects lasted maybe a few months or shorter. I don't know. So it was nice to try it, but you haven't done it in a long time. And kind of once I stopped all that stuff and got off the Ativan and the other pain pills I was on, I switched that to drinking, and I started becoming kind of a big drinker, and was more of a binge drinker, which was getting me into a lot of trouble. And and then I switched over to cutting and sex. And for me, it didn't matter whether it was cutting or smoking weed. To me, it all took me out of my head. It gave me that little vacation that I needed, or that little bit of a high that I wanted. And it was really, really helpful. But the problem is that the more I did it, the more I became used to it. And so it definitely helped in the short term. It's awesome in the short term, but the long-term problems I had with it was that I was getting some side effects from certain pills, and obviously scarring from cutting, and some problems with like the alcohol and whatever else. And they all shared one thing in common, which is that like I'd feel good when I did it, but the next day I usually had a crash. And the other problem is that OCD and the addiction often intertwined. So like if I was cutting, sometimes I would cut more than I really wanted to, because my OCD brain was like, you have to cut a certain amount of times. Just like when I was doing the light switch, it was like it had to be a certain number. So same with cutting, it had to be a certain number, even if I didn't want to anymore. So it was overlapping, and it was making me feel like I lost a little bit of control over that. So it was also feeding into that belief I had about myself that I deserved to be punished, that I didn't deserve love, all these like self-limiting thoughts. And it was really hard to move forward in therapy when I was still practicing all this stuff. And I wanted to get better. That's why I went to therapy. And I didn't end up finding a therapist I liked for a long time because, I wasn't ready to go. And I had to decide for myself that I wanted help with it. Because, for a long time, I was just like, why is this anyone else's problem? This is my business, and I'm not hurting anybody, so, like, people should just leave me alone. And, but eventually I did get help for it, and it's still a daily struggle. Like, I still think about this stuff all the time, but it's definitely getting easier, because what I've learned is that, I have to practice compassion and accepting myself, which is very difficult, as most of you know. And then like the CBT or ACT, or whatever you want to do. ACT is what I did. It was really, really helpful. I'm learning a lot of skills to deal with my emotions, like, coping skills. I never learned that, and I don't think a lot of people with OCD have. Because, like, when emotional stuff comes up that we don't like, we end up, like, not wanting to feel it and just get away from it, and it's very uncomfortable. So it's really a case of, like, developing these coping skills where, you can understand, like, how to tolerate certain things. Like, for me, when an emotion comes that I don't like, I'm better able now to say, okay, like, this isn't going to last forever. Like, I've handled worse before. Like, this is okay. I don't have to feel good all the time. Like, it's less of a, scary, horrible, not acceptable feeling, So it's definitely getting easier. But, drugs still have a place in my life. Like, I still take Ativan every once in a while when my anxiety is just, like, off the charts and I'm traveling and it's just, like, yeah. But that's the way the drug was meant to be used anyway, so I'm okay with that. And, I just take it one at a time. So, just to kind of sum it all up, if I really understand the whole, like, self-medicating thing, and it's been a huge struggle. It's, in a way, it's become its own monster besides the OCD one. I feel like, I know that it does help in the short term, but for me, the long term, it was not working out. So I decided for myself that I wanted something different, and so I got help for that. And, if it's something you're struggling with, I get it. And just know that you're not alone, and, there is help to get past that stuff if you want to. I think what it comes down to is that OCD is so painful in a lot of ways, and we just need to take care of ourselves and remind ourselves that we are worth taking care of. So, yeah, one day at a time. Stay strong.